Hello, dear friends. Today's talk is about back pain. How can you recognize the cause of back pain and what to do about it? The primary causes of back pain are the spine, related structures, and kidneys. The pain mechanism for kidney disease is as follows: either kidney inflammation called pyelonephritis or renal colic, which occurs because of the departure of stones in the urolithiasis. The mechanism of pain from the spine can be associated with a herniated disc, which can compress the spinal cord and nerve roots. It can also be inflammation of the intervertebral joints, known as spondyloarthritis. It can also be spasms of the muscles surrounding the spine and spasms of the back muscles in general, which can also contribute to the formation of back pain. The main differences between the two causes are the nature of the pain and its localization. If we take the pain in the kidneys, then most often this pain is very severe. A person having renal colic looks very characteristic. He has an earthy-colored face, very often nausea, intolerable pain, which is tidal, that is, lasts 20, 40, 60 minutes, then may come relief. Then the pain resumes again. And the most significant characteristic of kidney pain is that the person cannot find a position, literally. It is impossible to find a posture that will relieve the pain. In addition, renal pain has a definite localization. It starts from the back, namely from the lateral surface of the back, spreads obliquely to the side, and then to the anterior abdominal wall. The pain can go to the bladder area, to the inguinal fold, to the genitals, and even to the inner side of the thighs. Why does this happen? The fact is that the innervation of the kidney is closely related to the innervation of the ureter. The pain in pyelonephritis is associated with swelling, stretching of the renal capsule, and swelling of the fiber, which is located around the kidney. The onset of pain in urolithiasis is related to the beginning of stone movement. When the stone sits in the kidney and does not move, it does not cause pain to a person. But as soon as the stone moves, gets into the pelvis, then into the pelvic ureter segment, moves down the ureter itself and finally goes to the bladder, then passes through the urethra, then the pain accordingly changes depending on the position of the stone. With back pain, the pain is completely different. First, it is less intense, dull, and constant. The most important thing is that a person can find a position that can relieve this pain, or even for a while, you can forget about it. Pain, when the spine or spinal muscles are affected, occurs only when a person sits in some uncomfortable position, or moves, tries to bend over, or makes some movements. In the kidneys, the pain is always constant, regardless of whether a person does or does not make movements. There is pain even if you lie still. Sometimes it hurts so much that you must take strong painkillers. Many people think that if the pain is localized somewhere on the side or in the buttock, it is definitely the kidney. They do not realize that the spine is affected, but the pain is elsewhere. The fact is that in our body, nerve is distributed in segments. In the spinal cord, there are segments. Each spinal segment corresponds to a specific pair of spinal roots. Depending on which segment is affected, the pain will be distributed there. For example, if the third lumbar segment is affected, the pain will spread along the back surface of the buttock, will go to the side, to the lateral surface of the leg, and so on. Pain is transmitted along the nerves like an electric current through wires. If you break an electrical wire somewhere, the lights go out in the neighborhood. In the same way, the pain is caused by damage to the roots of the spinal nerves. The L3 root, for example, is pinched somewhere, and it is irradiated throughout the area that it provides. An additional criterion for determining the source of back pain can be a general urinalysis and a general blood test. If a person has pyelonephritis, there will be changes in the total urine analysis. There will be increased leukocytes. There may also be increased leukocytes in the blood and ESR erythrocyte sedimentation rate. Based on this, we can already lean towards the fact that the person likely has pyelonephritis. I had such a case in practice when a patient came with a characteristic pain in the kidney and did not sleep at all night before the visit. And on ultrasound, I could not find anything suitable, nothing to explain this pain. According to protocol, I referred her for a CT scan of the urinary organs. The fact is that a CT scan without contrast is the method of choice for suspected urolithiasis. It was by this protocol that I referred her. As a result, we got the answer: lower lobe inflammation pneumonia, which means inflammation of the lungs. Sometimes when lung inflammation is localized in the lower lobe and affects the pleura, which covers the diaphragm and the back of the chest, a person can have the same symptoms as in renal colic or pyelonephritis. We successfully treated the pneumonia, but this is the kind of case that added to my experience. What I wanted you to take away from this video is don't memorize everything. Remember the primary differences between kidney pain and non-kidney pain. In renal pain, increased intensity, attacks, nausea, and vomiting can occur. Kidney pain is the inability to bear the pain without painkillers, and it is necessarily irradiation of the pain to the lower abdomen, groin, and even the inner side of the thigh. Pain not caused by renal causes, such as spinal or muscle problems, is less intense, dull, always backward, downwards, and often to the side of the leg. Also, I wanted you to remember that if it is a suspicion of renal colic, if the symptoms are similar, the first method of diagnosing renal colic is not ultrasound, because you can get false negative results, but a CT scan without contrast. Thank you so much for listening to me to the end. I hope that this video will satisfy only your theoretical interest and that you will never need to apply this knowledge to yourself in practice. Thank you very much. See you soon. Always for you, Dr. PopMed.